As we come into a new phase of the pandemic, we're starting to understand a number of unusual patterns that really need to be studied. What has happened is that everyone has hoped that once the pandemic had passed, you have vaccinated your populations, people had gotten infected, that was it. Let's get back to normal. But because of this virus, and for those who underestimate this virus, I can only warn you that this is always going to catch you out. If you haven't forgotten, after the first summer, you thought it was over. Then the next summer, you thought it was over. And then the summer after that. This is not a normal virus. That's all I can say without getting into trouble. But when we look at what is happening, we now need to do an analysis on the post pandemic transitions. So, I'm going to be talking about this paper, Incidence of Respiratory Infections After the COVID-19 Pandemic, 2023 to 2024, and its association of vaccination among entire population in Korea. My goodness, what would we do without Japan and Korea doing the hard work? Because they are clearly interested in population health, which is why, after you have had a major pandemic, you have used novel technology, you have a novel virus, you should want to understand what implications this has for the health of your population. And if you don't, it really is very concerning. So, this is what we're going to be focused on today. Just before I start, I'd like to remind you, for those of you who have an interest in becoming a healer, you've always wanted to help people, but you don't know how to do it. I am creating an innovative concept and it's in a standstill. I've only just decided to do this in the past few days, and it is about trying to train people who have an interest in health as to how you can help in the post pandemic period. This is about joining our community. As this goes on, I'll be continuing to bring my curriculum, give you education. You're not going to become a doctor, but you should be able to help family and friends to understand what is happening and more critically guide them through some of the unusual patterns that we're going to see post pandemic. If you're interested, look in the link below. So let's get back to this topic. This, as I said, is a huge, important point. Let's go into a few of the points that they highlighted in the paper. Um, Patterns of respiratory infection have shifted in the post-COVID period. And this is the point that I'm making, is that don't underestimate how significantly we are going to see this happen, this transition. Influenza-like illnesses decreased during the pandemic. However, the incidence of upper respiratory tract infections and common colds surged in 2023. And this is the one I'm going to focus on. COVID-19 vaccination greater than 4 doses was associated with lower risks of lung infections and pertussis, or influenza-like illness and pertussis. Now, how in the world does that make sense? And we're not talking about a slight decrease. We're talking about a huge decrease. But get this, so follow this. Highly vaccinated region in Korea, they are finding that the people who have had more than 4 doses are protected against pertussis, where the number of cases has dropped significantly. But, here is the but. Coincidentally, pertussis incidence across the population rose 46 times above expected levels in late 2023. That makes absolutely no sense. But what you have to do is look at the data and try and make sense of what it means. This is where I'm going to share with you my thoughts. Now, remember, let's just make it clear. This is not what they have said in Korea. This is not what any major organization has told you. This is just me using an extrapolation of the science to try and understand what could be happening in the context of these unusual patterns post-pandemic. So just so that you have a better understanding here, is that when you look at these here, and this is pertussis here, before the pandemic, it was almost zero. During the pandemic, almost zero, and then a massive surge post-pandemic. And guess what? You weren't having pertussis in people who had 4 jabs. Wow. That must mean that the vaccine is protective against pertussis. Okay, I'll follow along to understand what I'm saying. Now, there's another important thing that is here that is quite relevant, and it's to do with, I'm trying to see if I can get my screen aligned for you, and that's to do with tuberculosis. And in Korea, what they found is that looking from 2016, this is here, 2016, this is the cases of tuberculosis, falling, hits the pandemic, continues to fall. Post-pandemic, this is January 21, suddenly it flattens, levels off, and starts to stay stable. So this represents an increase. What is going on? As I said before, you have on this side, pertussis has a 46-fold rise post-pandemic, and TB is also rising significantly as well. Something is not right. And when you look at pneumonia cases and some of the other things that are happening, they are falling lower than expected, so to speak, except, say, for instance, a common cold, which showed a significant surge afterwards. Something strange is going on. Okay, now this is where I will take you to my thoughts. Actually, before I do, there's one other point that I want to make here, is that in one of the tables here, they were looking at the study population and the vaccine status. And they were comparing here to the 4th dose, 3rd dose, 2 doses. This is a problem in my mind. They combined no doses and the 1st dose, and it may have been because of the cohort size. But I'm telling you that the people who've had only 1 dose, based on my extrapolations previously, have some of the worst outcomes, and I suspect have had adverse effects, which is why they didn't have a 2nd. So combining these together is potentially, depending on what number it is in 1st dose, will skew the results, which they have used as their reference point. So the reference point here is no vaccines and 1st dose. So I think that that's a problem, but take that aside. This is the bit when you look down at, there's influenza like illness, common cold. When you roll down to pertussis here, you can see here the number, if they've had, this is the column for 4 doses, only 428 cases, 0.06% compared to the reference, 94% reduction if you had 4 doses of the COVID vaccine. And I'm telling you, the COVID vaccine is not an antibiotic. Bordella pertussis is a bacteria, and it causes whooping cough, and it does it primarily by impacting on the cilia, the movement of the cilia in the upper airways, in the lungs, the bronchi and bronchioles, which is what makes the whooping cough. You have to do some very forceful coughs to clear the mucus, because the cilia, because of a toxin that the bacteria produces, freezes them in place. Now, this is where I'll do this important analysis. What I think is happening is that we have population immune suppression. Now, it may be a combination of factors. One of them, I think, could be linked to IgG4 levels, because IgG4 is a tolerant antibody. And so you have to follow my sequence of thought. So, although IgG4 is not directly connected with Bordella pertussis, what I suspect is happening is that with IgG4, the immune system in those who are over 4 doses is less likely to respond to an infection with SARS-CoV-2. So they will have less symptoms. And so it's a very important point. It doesn't mean that they aren't infected, they just have very mild symptoms. Now, this was supposed to be a good thing early in the pandemic because all you are concerned about is reducing severe disease. However, at this stage, where you have ongoing circulation of the virus, the mild symptoms are likely to indicate that the immune system is not necessarily clearing the virus well. My suspicion is that this cohort is becoming super spreaders, meaning that they don't clear the virus easily from their sinuses. They continue to spread it in waves, and this is why it continues to circulate. The importance of them being a super spreader is the fact that I am predicting that they are likely to have a persistent infection with SARS-CoV-2. Why is that important? One of the most important strategies that this virus uses is that it suppresses the interferon response. And that's the alarm signal for the immune system. So if you are not clearing the virus, it means that the interferon suppression is likely to be higher. Interferon is one of the most important factors that causes people to feel unwell. And so therefore, with low interferon, you won't really feel unwell. That doesn't mean that you don't have an infection. Now, follow along because two things have happened. Not just the fact that pertussis has risen, but also along with that is TB. So I'm going to show you again another slide here that I've just put together. When you look at how TB and pertussis spread, so TB is a beast of a bacteria. TB is like the SARS-CoV-2 of a bacteria. Some people just can't get rid of it. And so because of that, the immune system tends to trap it in the lungs and wrap immune cells around it. And so people, when they're becoming immune suppressed, they can have a reactivation of tuberculosis. This is spread by droplets, but so as well is pertussis. So my suspicion is that you're having a higher spread of droplets with pertussis, potentially TB, infecting other people. Okay? Now, this is very important because when we think of how the diagnosis with pertussis is made, it's the whooping cough. So if the cough is not there or is mild, you won't necessarily make the connection that it is pertussis and whooping cough, so they won't get bacteria. They won't get antibiotics. So here is my thought as to what I think is happening. One, Omicron has a predilection for the upper airways and the bronchioles. So instead of with the earlier variants that would tend to go all the way down in the lungs and contribute to severe COVID, Omicron tends to stay in the bronchi and the bronchioles. And this is why you will get the 100-day cough. So what I think has been happening is that instead of people having a whooping cough, they have had a milder, persistent cough, more like a smoker's cough. It's just there all the time. They're just coughing and coughing. And this is what we saw with Omicron. And my suspicion is that we're having an overlap of symptoms here, where instead of the full-blown symptoms, you get subclinical disease. And this is why I think in the over 4 vaccinated, we are seeing a significant fall off in their cases, their diagnosis, but alongside that, a 46% rise in pertussis. I suspect that we're having silent spreaders. That's what's going on. And it raises a really important question. In the past, there was a lot of pressure on the unvaccinated cohorts because they were putting everybody at risk. I am now concerned that we have a cohort of vaccinated who have a low immune response with low interferon production, some degree of immune suppression, persistent infection, who may therefore be a risk to everyone around them. If that is the case, we need to help them. We need to identify who they are, treat the associated infections so that they get better, and critically, they don't put other people around them at risk. This is big stuff. And the problem for public health will be they would have to acknowledge that they have potentially created a problem that now needs to be addressed. Nobody wants to do that. And at the moment, all we're getting is silence. The question is, what do you do in the context of this information? It's a lot to put together. And so it's just a reminder, if you want to join the community where we are going to be exploring this kind of thing, come along. And the community isn't free, but the Root Healer orientation guide is, so that you can see what we're talking about. Because this is the kind of situation where you need the community to help. If you see somebody who has a chronic cough, they're not a smoker, your knowledge about this may be able to help them to know that this is something that needs to be addressed. It may be just the guidance that they need to see their doctor. Maybe they need a course of antibiotics. Maybe they need extra vitamin D, something to help with the interferon. Maybe they need to hum, good old-fashioned humming. If you understand these things, you can then become an advocate for them, to help them. And this is what is needed more than ever. People who have an interest, who have a passion, who are able to communicate well, and who can understand basic, not necessarily complex science. If you can understand what I'm talking about here, you will understand what I'll be putting together. So I think we have a huge challenge ahead of us, because we can't afford diseases like TB to start spreading, because believe me, whatever your vaccination status, you don't want to be exposed to TB. It is one of the most difficult bacteria that the immune system can face. And as I said, for most people, the immune system can't even get rid of it, and it locks it away into tiny granulomas in the lung because it can't get rid of it. That's the kind of thing that we need to address, and very quickly, because nobody seems to be talking about it, even though the implications could be so serious. So as I said, like, subscribe, comment, look at the link for the STAN community, and let me know what you think. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.